This webinar is being brought to you by the American College of Radiology and the American College of Radiology Commission on Radiation Oncology Education Committee. This is your co-host, Hina Saeed from the Medical College of Wisconsin, Department of Radiation Oncology, to discuss a very interesting topic on leadership perspectives. I have my co-host here, Dr. Anna Laucis, who will be moderating today's webinar. Dr. Laucis is a PGY4 radiation oncology resident physician at the University of Michigan. She is currently serving in the elected role of radiation oncology representative on ACR Resident and Fellow Section, the RFS Executive Board. She also serves in the elected role of RFS representative on AMA Women Physician Section Governing Council. Thank you very much, Dr. Laucis.
Thank you so much, Dr. Saeed. So I'd like to welcome everyone to this webinar. We're really excited to partner with the ACR, the Commission on Radiation Oncology, and we have a great panel here today to go over leadership perspectives and to talk more about involvement with the ACR. So really excited to have all of our panelists here. And so first would like to introduce, so I guess we can start from left to right. So Dr. Camille Williams, we're so excited to have her here today. She is a leader on the ACR Committee for Women and Diversity. And so very excited to have her here with us. Moving on to Dr. Daniel Chang. So he is currently at Stanford and serves as one of the ACR journal advisor editors for the GI section and is a leader in Astro, ASCO, and the NCCN as well. And then moving again to the right, Dr. Schechter. She is currently at USC, the Quality and Safety Director for Radiation Oncology, and also has played a key role on the ACR Commission on Radiation Oncology as the practice parameter lead. So very excited to have her. And then there's me in the middle here, and then Dr. Saeed. And then on the far right here, I'm Dr. Blumberg, who is currently retired, but is a past president of the ACR, and actually will be receiving the ACR Gold Medal this May at the annual meeting. So served as the past president of the ACR, as well as the chair of the Commission on Radiation Oncology for 5 years. So we're very excited to have our panel. And just sort of before we launch into the Q&A portion, just wanted to go over a few housekeeping items for all of our attendees. We're so excited to have all of you join as well. So how this will be structured is we will be focusing for about the first 30 minutes or so for sort of some planned questions to our panelists. And then feel free throughout the presentation using the chat feature to submit questions, because we will reserve about the final 15 minutes of our webinar for audience questions. And if there are sort of too many questions to cover all of them, we'll kind of group them into sort of themes and try and do that. And feel free to address questions to the entire panel or just specific panelists. Finally, I just wanted to state that I've been very fortunate to be in this role of radiation oncology representative on the ACR resident and fellow section executive committee. Has been a great experience, and being an ACR member has a lot of benefits. So we'll highlight some of those today, but also encourage you to come to the annual meeting in May to learn more. And so finally, sort of when the webinar ends, we encourage you to fill out the quick survey as well, because that will help provide feedback for our quarterly session. So with that, I just want to make sure I haven't missed anything. But really also huge thanks to Teresa Powell, who is not visualized here on the screen, but has been a huge supporter of this effort and really started all of this. So really huge thanks to Ms. Powell and sort of everyone at the ACR for supporting this. All right, so sort of launching into our questions. So wanted to direct our first question to Dr. Williams here on the far left. So what qualities are essential for physician leaders?
Well, in order to address that question, there are two parts to being a physician leader. The first is at your physician. And so you have to be the best you can in your crafts. That's the first thing. That goes without saying, that you ought to be a subject matter expert. The second part about being a leader, that is not usually easy, especially since most folks think that because you're a physician, you're automatically a leader. That's not always the case. So we have to look at how we want to develop our leadership. Some of the things that are essential for that is that you have to begin with yourself. You have to learn about leadership, because that's not something that's there. We learn a lot about our specialty, but we have to take that extra step to develop leadership itself by attending leadership courses, participating in the ACR in certain leadership roles. All of that contribute to being a leader. Another area that is essential in being a leader is that you have to be team focused and try to develop the team that you are in. Always ask, what can I do to make my team better? That's essential. It's not always about you being the leader and being dogmatic. It's always about the team approach. Also, there are also two sides of management. You have to provide direction and focus, but know how to take suggestions from others. A lot of time, that's a complaint that comes in, that most leaders, they're at the forefront and they're telling folks what to do, but they're not willing to listen. So it's important to have an open door policy so that others can tell you what their thought processes are on whatever the mission or whatever the goal may be. And lastly, I think you have to be passionate. You have to be excited and motivated about whatever it is that you're involved in. So if you're in charge of the clinic, if you're in an ACR role, if you're not motivated about it, it will be difficult to get others to follow you and be motivated about the leadership role that you're in. So those are just some of the top things that I think are essential, or some of the top qualities.
Well, thank you so much, Dr. Williams. I think that message really resonates with a lot of us, and I agree. I think the first thing, being a physician, that in and of itself is a leader, within the health team, within the community, and hopefully we can touch on some of these themes, sort of as we go along with the webinar. So I will shift gears a little bit to just go to a different question, but we will give the other panelists a chance to answer this particular question in just a little bit here. Oh, I'm so sorry. I was muted, I think. Not sure if that came across. So I will say that again. So our next question to Dr. Chang, what have you found to be the best way to develop leadership skills during your career?
Yeah, I mean, that's it's not a simple question. And I wish I had the magic, formula to say, do this, follow these steps, and instantly become a leader, because I think it is something that it kind of starts on it, it's an everyday type of thing, as far as how you interact with people. I generally try to preach, to my trainees and folks that, how, every little thing and action that you do each day is something that contributes to how people will view you, whether you are someone who could be seen as a leader or somebody who may not be seen as a leader. So it comes down to, how you interact with people, how you are empathetic to them, how you are understanding them, how open you are to them, how genuine you are to them. So I think that, just your everyday interactions can be very, very good, training exercises or just opportunities, I would say, for you to really help give guidance, help lead people, help teach them, whether you're giving a lecture, whether you're mentoring them, whether you're doing any type of coaching, those are opportunities. There are obviously formal ways that you can get leadership skills through leadership workshops. Obviously read books, read articles. There's a number of good articles that are published pretty regularly on the topics of leadership. And I think most importantly is really you got to figure out kind of what your style is and what matches you, because you can't be everything to everyone. And I think you don't want to try to be a way that is sort of doesn't come natural to you. I think that you kind of need to find your leadership style, obviously have good self-awareness and learn about your strengths. So, probably one of the early steps would be to really do, whether a formal or informal assessment of yourself, to decide, you know, to determine what are the strengths that you are naturally good at that put you in a position for leadership, and then obviously knowing your weaknesses to know what you can work on. So it's probably through a mix of the, you know, the formal education and training opportunities, but then you really need to kind of be aware of those in your day-to-day life so that you can kind of continue to refine, exercise, and develop it.
Well, thank you so much for that response. I agree that there's sort of formal ways and non-formal ways to really develop leadership skills, and really appreciate that response. So great. And so hopefully we can also touch on this particular question, get more panelist perspective on this as well. But just to sort of make sure that we sort of get through some of our questions here for each of the panelists, just wanted to move on to a third question. This one for Dr. Schechter. So what advice do you have for trainees and faculty to become more involved in the ACR and organized medicine?
From personal experience, it was really just volunteering and joining the conversation, as my chair would say, and then finding, as the other panelists have indicated, your niche, your tendency of interest, what you want to learn about, your devotion to a best practice in some area, and best outcomes. And for me, it was quality. I became a surveyor so that for the ACR, so that I would learn what they were looking for, essentially. I became involved with the practice parameters so that I could know what changes are coming forward. And you know, with other organizations like Astro on the MDQA committee, again, so that I could be a part of that conversation and understand what's coming and be able to prepare my own institution for that. So I didn't set out to be a leader, and I'm honored to be on this panel. I just really kind of dove deep in a area of interest for myself and for my group, so that I could stay ahead of the curve, so to speak.
Excellent. Well, yeah, thank you so much for that perspective. And that's a really cool way to phrase it, joining the conversation. You know, sometimes it just means sort of getting a seat at the table. So that, you know, I think that's a really cool way to sort of think about it. So thanks for sharing that. And again, we can sort of touch on this as well. And it's kind of related to actually a question for Dr. Blumberg next. So for Dr. Blumberg, how has your involvement as a leader in the ACR impacted your career, and what are the benefits of being an ACR member?
I would say that what Naomi said is how I got involved. I volunteered for various committees, various assignments in various organizations in organized medicine, both in the state level and in our state AMA chapter, as well as our state ACR chapter. And I took on responsibilities. People saw that they could count on me to get the job done, and they rewarded me with more responsibilities. And ultimately, those responsibilities were associated with officership. And I like being active. I like being involved. I like being in the inner group to know what's happening, just like Naomi said, to understand better so I could advise the people in my practice, the people in my hospital, you know, what was happening in a bigger picture, both at the state level and national level. I had the privilege of being an ACR delegate to the AMA for 20 years, and that was very important, interacting with other physicians, because as Dr. Williams said, we're physicians first, radiologists second. We take care of patients just like every other physician, and we need to be visible to our physician colleagues, not because they are a referral source for us in terms of the patients we're involved in our careers, but also because we have the opportunity to remind them that we're not just people sitting in a dark room, hiding in the basement somewhere, never coming out for sunlight because you get to work when it's dark and you leave when it's dark, at least in the winter. And I find that being in a position to give back to my specialty, to my profession, gave me a lot of personal satisfaction. And it made my career more complete. It made my satisfaction, who I was and what I was doing, more meaningful. I think the benefits of being an ACR member is that we are the largest socioeconomic organization in organized medicine for radiology, radiation oncology, nuclear medicine, and physics. And being part of a bigger whole allows you to accomplish more. The ACR really is the 800-pound gorilla in many of the aspects that we need to be involved in, either at the RUC or at the CPT coding panel, in Congress, in our state legislatures. The ACR has the resources to make us more effective as involved physicians. And I'm very grateful for having been active in the ACR for as many years as I've been active.
Thank you so much. Yeah, and I think sort of a common theme I'm hearing from both Dr. Schechter and Dr. Blumberg is sort of, it maybe starts with volunteering, serving on a committee, sort of starts in a place of service, ultimately trying to do the best thing for our patients. Because I think, at least for me, that's really what, being involved in organizations like the ACR and AMA have meant. Truly, like, advocacy is a way to, and organized medicine is a way to really ultimately bring the best care to our patients. So great. Well, thank you all for those perspectives. So now I guess to sort of shift gears a little bit, going back to maybe Dr. Williams first, but maybe a question for the whole group is maybe, what current challenges do you face as a leader in radiation oncology?
Well, I don't think I'm unique with this, but the biggest challenge is not only in radiation oncology, but I think about any specialty is time. You find yourself being asked to do a lot of different things, and you have to do that time management. Currently, for me, it's you're a practicing physician, you have your administrative responsibilities, you're involved with community outreach, especially in oncology. I really do enjoy doing the advocacy portion. So I'm in my community quite a bit, talking to them about what radiation is, what we can do to help, and why they should come in for treatment. Then I'm also an active committee member on the ACR for radiation oncology as well. Mentorship, that's important to me. And so I try to be involved with those residents who are coming up. So for me, when it comes to the challenges, the biggest one is time and time management. And then there's also the other part of it is team management. Being a part of a department and being a director in leadership in radiation oncology, everyone looks to you for leadership. And so you have to be able to develop your team using the leadership skills that we have discussed. A lot of times as well, we think maybe leadership skills are only for the physician. But we here, where I am currently, we encourage discussion of leadership skills within the entire clinic. What are the responsibilities that others may have, and how can you delegate? Which is where physicians can also be difficult in letting go of certain responsibilities and having doing delegation. So those for me are some of the challenges: is the time management and developing my team, remaining active and involved in the community, in the HCR, and in other leadership capacities.
Excellent. Yeah, well, thank you so much for that perspective, Dr. Williams. Just wanted to open it to the rest of the panel, because I'm sure sort of everyone being at different stages in their career and having gone through, different experiences, what current challenges do you all face as leaders, not only in radiation oncology, but within the ACR, and, maybe what advice do you have to some of our listeners?
I'll just follow up first. I think for me, time management is really key. with what the federal government is insisting upon all physicians in terms of documentation, challenges, your diagnostic colleagues are really have their hands full with the appropriate use criteria issue and how are they going to convince referring physicians to fill out the paperwork and how that's going to potentially negatively impact them on collections. These are issues that are ongoing. They're not limited to diagnostic radiology. They're not limited to orthopedics, cardiology. And as the practice gets more challenging, the I's that have to be dotted, the T's that have to be crossed in a practice setting, which all of us have been involved in or are currently involved in, then when you factor in personal needs, time with your family, time with significant others, time with friends, time to do the things that help you grow as a person, to make you a more compassionate, more understanding, more sympathetic human being, there's only so much time in the day. And I don't know how many people who are listening have dealt with changing from one electronic medical record to another because your hospital's decided that they automatically need to do this. And then you have to learn a whole brand new system with all of its complexities and intricacies. You know, if you're at your office for 10 to 12 hours, it doesn't leave you a lot of time for anything else, including being active in various aspects of organized radiology, radiation oncology, medicine, your hospital. I mean, these are all key areas for someone like us to be involved in because it becomes very easy for us to become invisible. And when you become invisible or you're seen as not having a valid voice, it's detrimental to you, to your practice, to your patients, to your staff. So time management is really key.
Yeah, I think to go ahead, Dr. Chang.
Yeah, I mean, I certainly agree with that. I mean, that obviously is a huge challenge, and I certainly don't dispute it. I probably would also add, I guess, some additional things for me. I see it as kind of two challenges. There's always the organizational, professional challenges that you face at work, and that probably has to do with some of the things that are mentioned as far as how you deal with, you know, the challenges with team management, those types of things. But I think first and foremost, it's more that individual challenge, which is making sure that you yourself are taken care of. You know, if you cannot really take care of others if you don't take care of yourself. So ensuring that, you know, if you are going to take on a leadership position or any kind of leadership role, you know, you really got to ask yourself, you know, one, is it something that you want to do, and is it a passion for you to do it, or that you will enjoy, or is that you really want to make as part of your, you know, list of responsibilities. And that speaks to, you know, if you have family, wanting to make sure that your family can balance you and you don't have to make hopefully sacrifices that you're not prepared to make. I think starting yourself out in a good position is really the most important thing, because you're going to need that foundation to be able to handle all the things that come at you in your professional challenges, which are the daily draining things, perhaps like the personnel issues that can often be quite draining, even though many of them may wind up being very mundane, but they can wind up being some of the most emotionally draining things that you have to work with. And I think you also have to be in a good position, because I think a lot of that team management and dealing with personnel conflict and things like that really has to do with being able to have hopefully the patience and make the effort to really understand people, because conflict usually often arises just from, I think, from just misalignment of either perspective or expectation. And I think as the leader, your job in many ways can be as a moderator that really needs to make sure that you can connect to both sides and find a way to bridge that. And you can't do that if, of course, if you're constantly stressed about, you know, some family obligation that you don't have tucked away. So I think that having yourself taken care of is the most fundamental aspect to really get yourself prepared for the kind of the challenges you face at work. So that's what I would add.
Yeah, thank you so much for that, Dr. Chang, and just sort of summarizing a few of the opinions before I get to Dr. Schechter's thoughts on this. You know, if what I'm hearing is we kind of have limited resources, as people, not just as a leader, but time is certainly one of them. Dr. Williams, Dr. Blumberg touched on that. Time management is super important. Along with that, energy and money. I'm kind of reading a book right now where it talks about these 3 buckets: time, energy, and money. And these are really the things that we have to offer. And of course, like energy, I think it ties into what you mentioned, Dr. Chang, the emotional impact, whether it's, dealing with cancer patients day in and day out, or any personal struggles at home. These are going to be things that pull away our energy and attention and time. And so maybe just, especially one of the things I focus on is wellness, and sort of how can we as individuals sort of, even if there's a lot going on in the background, bring our best self to work and to show up for our patients and family. And of course, it's not an easy thing. There are many challenges, but certainly I think that's very important. So Dr. Schechter, what are your thoughts about current challenges that you face?
Oh, well, I certainly do think about this on a couple of different levels. One that I'd like to bring forward, since we do have an audience, and I'm a quality, maybe quality is my niche, and I'm speaking to people in residency or junior faculty as well. You do need to consider that if you're in an academic setting, that the leadership roles are considered service, and you still need to leave time for your academic productivity. And there are universities such as UCSF that since 2011, 2012 have a path, like an educator path. They have a quality path where you can be promoted based on your work in that arena. And I also will let you know that I am supported by my administration for 20% of my time. So I like to advocate for people to respect themselves in terms of the commitment that they're making, and understand that you want administrative support, and you want, but you don't want to get too early in your career, perhaps even too concerned with the leadership and administrative roles, when you still need to build your research portfolio for your own progression. And but from a balance, that my other thing that I've learned is from reading a lot of these books, as people have mentioned, on change management and leadership, they all come back to story, which led me personally to investigation of writing. And frankly, that's where emotion and senses and conflict can reside, and you can evaluate the dilemmas that you have in your career and life and sort them out in writing. And I've started to write stories around my quality work. And I think that we deny ourselves in radiation oncology. We're very much engineers. And I think we need to make sure that we're addressing the emotional content of our lives and our experience with our patients. And there are books like The Art of Empathy and The Language of Emotions that I would recommend. And you can better understand yourself and your patient's emotions, and be there when they are having a difficult time.
Well, thank you for that. And I think this kind of leads into something that I've thought a lot about, and I'm sure a lot of us have, but sort of in the realm of wellness and burnout in particular, sort of both you, Dr. Schechter, and Dr. Chang have touched on this sort of emotional toll of what we do, not just with our patients, but also, our personal life, our families. And there's this idea of like moral injury, and sort of particularly thinking about like stories and narrative, as you've touched on, Dr. Schechter. One of the things that I think a lot about is, as a radiation oncology trainee and future radiation oncologist, oftentimes we kind of absorb these traumas of our patients. We're constantly talking to people about end of life issues or cancer recurrence or these very difficult things. And it's sort of, how do we, in terms of the bucket analogy, right, like our energy and sort of attention to that, over time it kind of gets drained down, and how can we replenish that? And so it's important for us to have these coping skills that, various books, as you've mentioned, or one of my favorites, Brene Brown, who has a lot of TED Talks and books as well, sort of on vulnerability and courage, and how it's all kind of interrelated. But I think, sort of the stronger we can become as individuals and as leaders, we can be there for our patients. So we actually have had a few questions from the audience, so just wanted to now sort of shift to that. So just starting with one of the questions, and this can be to the whole panel, any advice on ways to get involved in the ACR? I guess sort of specifically thinking about, you know, practical things that people can do who are listening in and maybe hearing about the ACR for the first time, or ACR members but just haven't gotten as involved.
The ACR is always looking for volunteers. Frequently in the ACR bulletin, whoever's chair of the Board of Chancellors puts out a call to remind people that we have thousands of people who serve in various capacities on all the various committees. And I guess I would advise, in addition to checking out opportunities at the state chapter level, as far as the national level is concerned, we have various commissions, and each of the commissions have multiple committees, including the Commission on Radiation Oncology. And you could send an email to the person who's chair of that committee, let them know that you're interested, and begin a dialogue about how they can get involved. When I was in those various positions, I was always looking for people who wanted to contribute, who wanted to serve, and would be in a position where I could provide hopefully some mentorship and allow them the first steps to get involved in the college at the level that they're prepared to serve at.
Great, thank you so much for that, Dr. Blumberg. Would any other panelists like to answer that question of sort of ways to get involved with the ACR?
I am aware that they are always looking for surveyors, so that's a good place to start. And I was also advised to go to the ACR even as a choice of organization because it's relatively a smaller group and you can really take on responsibility. When you look at Astro, sometimes you know it's hard to get onto a committee or it might take you several years, whereas with the ACR you can more easily start out and demonstrate your eagerness to participate and contribute.
Thanks so much. That's a really great thought. And yeah, like, you know, I definitely second that. It's of course, Astro and sort of Aero, you know, for the residents on the call are great ways to get involved. But I think the ACR, you know, you might not think of it because it's American College of Radiology, but certainly radiation oncology is a key part of that. And there are opportunities like the Commission on Radiation Oncology and Education Committee within that, you know, that's helping support this webinar series. And then, you know, KAROS, the chapter of radiation oncology groups. So sort of a number of ways within the ACR to get involved. But Dr. Chang and Dr. Williams, do you guys have perspectives on this?
Well, I can start by saying I actually started out as a physician surveyor for the American College of Radiology, and it was a very unique experience because it gave me the opportunity to see what is going on in other clinics, if you will, what if they. So my recommendation really would be to be true to yourself and consider what it is that you may be interested in. Are you interested in education, in economics? Find that committee or commission that you're interested in. And even if you're not able to fully commit as a full volunteer, maybe assist someone that's in that capacity. So if there is someone who is, for example, the secretary, you can assist as, see what you can help the secretary with, and you learn that job, but you'll also be learning more about the organization as a whole. And so I don't think you have to full-fledged volunteer for a position right away. You can also join as an observer initially to see what it is that they're doing, and then eventually work your way into a position or as a full-fledged volunteer. But again, you mentioned time, so it's best to be honest with yourself to see what it is that you are interested in, because then there will be longevity in whatever capacity you choose to serve in.
Yeah, thank you so much. Go ahead, Dr. Chang.
I mean, I'm relatively new to the ACR, admittedly, because I joined on the editor team about a year ago. So I'm a little less familiar with all the whole, gambit of opportunities. But I do think, echoing, I think it was Dr. Bloomberg's kind of sentiment, which is really, to volunteer and make yourself known, because I think many people would be very happy to have a large pool of willing and able volunteers. So just kind of getting yourself out there and letting the higher ups know that you have interest, I think, is probably the key first step. But my general advice, maybe not specific to ACR, but really for any kind of committee or effort that you do take, is it's a bit more practical, not as high level, but just really like follow through and do what you take on to do. Don't be difficult and slow. The faster you can get things done and get those things done without constant reminders and those types of things. I think everyone on this panel very much enjoys working with people who don't need that first or second reminder of things. So being timely and responsive and answering of your emails promptly. I mean, those are like very basic things that I think often we tend not to recognize it, but those things very often do lead to additional opportunities, because people will look back and think, this so-and-so was really easy to work with. They did a great job. They were very thoughtful. They followed through with everything. They'd be great for this next thing that we're looking for. So those little things, I think, can really have a huge impact, but that we don't necessarily connect immediately.
And
Yeah.
I would just add, as I'm thinking about what Dr. Chang just said, that an easy way to get known, because we represent a small portion of the ACR's 32,000 members, is to contact either Teresa Powell, who is staff for our commission, or Bill Small, who is chairman of the commission. Bill Small's at Loyola University, chair of that department, and let them know that you're interested, because many of the other commissions in the college want to have radiation oncologists as part of a broader perspective of all of the branches of radiology. And many times we end up cycling the same people to these various commissions because we don't have enough of a large enough farm team, so to speak. So those are two names that you can consider, Teresa Powell or Bill Small, and I know that they would be happy to hear from anyone on this webinar.
Great. Yeah, thank you so much for that. So shifting gears to another audience question that's come through, and this I think was for Dr. Blumberg, but I guess for any of the panelists as well. What are some of the mistakes you made in your career that you can provide advice for current residents?
Without trying to get too specific or personal, I would say that probably an important two lessons that I learned early on were, number one, it's not necessary for me to be the first person to answer a question posed by who's ever at the podium, because if you do that constantly, some of the more quiet people in the group may feel shut out or uncomfortable in expressing opinion, or you may get a reputation for being maybe too much of a hotshot. And invariably, I found that other people have the same thought process that I have, and it's nice to have someone else offer it initially, and then I can say me too or second that after there's been some discussion. Sometimes when you're the first person throwing out an idea, as the discussion goes on and there's a lot more speakers, your idea kind of gets lost, and then you have to redirect them. And the other thing that I learned is that there are times when you can get too far ahead of the group that you're involved in, and and you don't want to end up having a bunch of arrows in your back. And so it's very important to remember that you are, even as the leader, part of a team, and you need to consult, interact, and solicit opinions from everyone else, so you don't get all gung-ho about providing an avenue that no one else wants to travel on. So if no one else wants to travel on, it's either a bad idea or you have to do a lot more education to build a foundation of support among the people you're trying to motivate.
Yeah, well, thank you so much, Dr. Blumberg. I think those are all really important things to think about. I guess, does anyone else want to take a stab at, maybe lessons learned from mistakes made, particularly thinking for the residents who might be on the call?
Well, I think what I can contribute to that for my lesson learned is that it's okay to say no sometimes. So I started out by being on a lot of committees. I was very passionate about diversity committee issues, but I could not be on a committee for every organization for that. So I had to start on the organization that I want to serve on. So I'm currently on the ACR Commission for Women and Diversity, as well as the ACR Commission for Radiation Oncology. So I'm strategic about what committees I want to be on, which organizations I want to participate in, and then that's a stop. Maybe 4 max, because then we go back to speaking of what Dr. Chan said earlier, you have to consider about self-preservation. And I always refer to that as I have to make sure my oxygen mask is on first before I can attend to anyone else. And sometimes when you're in a position where you are quick to respond to emails, you are very responsive, you're motivated, people tend to volunteer you for more stuff. And so I had to learn early, it was a mistake in my career, but I had to learn early that it's okay to say no, and then to say, thank you so much for thinking of me, but at this point, I'm at my maximum as far as my commitment. And I don't want to overstep that, and I want to be able to serve you appropriately, and I would not be able to do that if I take on another responsibility. So self-preservation, and it's okay to say no.
That's a really important lesson. And actually, that's, I think, kind of the name of the book I'm reading that I mentioned with those 3 buckets is kind of how to say no, but like do it in a way where, yeah, you're selective about the things you're doing. But I think also touches on a lot of the themes we've been talking about, sort of time, and energy are precious resources, and how can we sort of, still, like, if we're, and sort of on Dr. Schechter's point of joining the conversation, being selective in that, because it'd be great to be involved in every conversation, but then you're spread too thin. And then also Dr. Ching's point about, follow through on commitments. That's definitely advice I got early on as well, that it's great to volunteer for a lot of things, but if you're too stretched, then that you can't complete those things, definitely that's like a courtesy and sort of respect thing as well. You really have to, if you're going to sign up for it, make sure that you have the time, energy, and resource to complete it and do a good job, because it doesn't help anyone if you're not able to do that. And then I'm forgetting if we've heard from everyone on this question or not. We do have some, or actually I guess a question that just came through sort of on this topic, so I'll just do that and then go back to the order the questions came in. But a question from the audience said, how can you say no and not hurt your progress?
Oh, that would be somebody else next to answer, and then I'll come in.
I mean, I would tie that to probably the previous question about, obviously saying no, it's easier said than done, because I think, especially being a young, hungry, resident, junior faculty, you do worry, and I still struggle with it too. You do worry that if you pass on an opportunity, you never know when the next one will come around, or you will kind of shoot yourself in the foot, that type of thing. I mean, I think that the approach that I took, and whether it was the right one or if this was a big mistake of mine, is that I did tend to say yes to as many things as I could, just because of that, FOMO, fear of missing out. And I probably, looking back, realized that some of the things I probably didn't need to say yes to. Some of the things may have put an unnecessary strain on something that didn't have to be strained on, whether it was something related to family or something with some other important thing that I was working on. I think the only real solution that I've been able to come up with, which you kind of get better perspective, I guess, as you get older, is just you realize once you have a broader view of things, you can figure out kind of what are the things that are actually meaningful and important. Because you could do a bunch of stuff and it sounds good, even though it's not something you care that much about, but you're doing it because you think it helps your career. But I think the sooner you can get a clear perspective on what are those things that help you towards whatever end goal you would have for yourself, that's probably where you want to concentrate. And then anything else, you kind of just got to resist the urge and just be okay with letting that go. And I think this is where having good mentors can really help you with this. Like really, hopefully you can find that really good trusted mentor who knows you well and has a good perspective on this as well, and can really help guide you on things that they can tell you, the juice to squeeze ratio on this is not going to be worth your time, etc. And those kinds of things I think would be really, that's an ongoing challenge. So that kind of answers both questions.
So I think just to jump in on that, since I'm the one who said that, is it's really tact, and that you learn over time. And I never say quite just, no, I can't do that. It's just how you present the case. So for example, if I'm asked to be in another committee, I wouldn't say, well, no, I cannot do that. I would say, well, let's see, what exactly are the requirements? And then I'll let the person know who's asking me, okay, well, I am on A, B, C, D, and E right now. I really would love to have that opportunity to work with you, but is it possible to consider that position in a year or two when my commitment to this other committee is up? Because I want to, if I participate in this committee or this, give it the best that I have. And with being involved in 5 or 6 other committees, or if you're studying for your boards right now, or I really think that we don't think folks who are asking us things can understand. They do understand. So if you're studying for your boards, or if you're starting a new job, or if you're relocating, it's okay to say that, because they're people too. And you have to give the benefit of the doubt that they will understand. Let them know you are interested, but if it's possible to perhaps approach this in another 6 months or 10 months, when I'm finished with my boards, or I say to engage them in conversation and to just be transparent, be honest, and let them know if you do appreciate it, or don't say you don't appreciate it. They thought of you. So really express that appreciation, but let them know where you are, why it is that you cannot accept it right now, but never close that door, because you want to be considered later on as well. But just right now in my life, I'm involved in 5 things and studying for my boards. I'm trying to do this. There's no radiation oncologist or radiologist who would not understand that the process it takes to get to certain level. So I think that's it, and you'll be surprised the answer that, okay, that's reasonable. Let me ask the next person in line, or you can check. That's my approach. It's just to engage in a conversation and be realistic. Say, this is where I am, and maybe I could join you another time.
Yeah, thank you so much, Dr. Williams and Dr. Ching, and well, everyone who's given perspective on this. I think it's a really important thing, because we often think no means it's closing a door, but sort of that old analogy of a door closes and a window opens, or a door closes and 10 more open. It's definitely true, and I think it sort of just, as Dr. Chang had touched on, and you, Dr. Williams, as well, sort of showing, okay, I'm involved in these various things, demonstrating your interest in that, and sort of that alternative to say not just no, period, but like no, but here's someone else you could consider for this, and even volunteering someone, and that's a way of mentoring, sponsoring, sort of helping others as well. Dr. Schechter, just wanted to see if you or Dr. Blumberg, but maybe starting with Dr. Schechter, if you had any thoughts on this as well. We have about 10 minutes left, so just want to maybe ask one final question at the end, but Dr. Schechter, sort of on this topic of saying no, sort of commitments, even mentorship, sort of your thoughts.
So I think it has to do with aligning what you're doing with your goals. And I think it's not like you have to have a goal to have a goal, but if you have a goal, then when an opportunity arises and it fits somehow in your puzzle path, you'll recognize it. And I have come to the point in my commitments, for example, this year, where my own chair has said, you know, you're going to have to say no to some things. I never thought he would be telling me that. But, you know, I have, but I think respectfully, everyone will understand if you're trying to do the best job you can at what you have on your plate, that they would want you to do that kind of a job for them. They will give you that time.
Yeah, that's a very good point. So, oh, I'm sorry, I think it might have just cut out. Did you have anything to finish saying, Dr. Schechter?
I'll let Dr. Blumberg.
Okay, Dr. Blumberg, thoughts on saying no?
I think Dr. Williams framed it excellently. The key is to not shut a door, to let people know that you want to be involved, but for a variety of reasons that anybody should be able to understand that this is not the ideal time for you to accept that additional responsibility, because actually what's worse for your obtaining whatever long-term goals you think you have is to accept the responsibility and flub it, because no one's going to come back and ask you again if you blew it on the last request or assignment. People respect the fact that you are able to say no, and you can do it politely, you can do it nicely, and you can let them know that maybe not this year, but next year I'd be honored to be considered again for this opportunity. Because you don't really want, you want to continue to build on a track record that you're a go-to person, that you can achieve the result that the person who's making the request expects to be achieved. Because if you can't achieve that, either because of your own personal skill set or your interest, then you really should say no. And that could be a firmer no than the no that Dr. Williams initially offered up of saying, not this year, but maybe next year or the year after.
I mean, the one thing I just want to add is, you know, I know it sounds easy to say, if I had direction, then I know exactly what I want to do and would focus everything towards it. But there may be a number of you, like myself at the time, who didn't know what that direction was. So my general rule of thumb is I would say yes more often than you say no, but obviously it is okay to say no. And I think, you know, do more favors than you ask of others, I think is another rule of thumb that I have. So that way, at least you're showing, you know, a willingness and a track record, and you can still build on that.
And one of the advantages of saying yes, and Dr. Chang just shared it, is the fact that if it's a completely unknown opportunity for you, that's a way to grow, to learn, and to really begin to understand what makes you happy in organizations. Maybe you have no ability to work well with, you don't like math, or you don't like numbers, so you never want to be treasurer or on the finance committee or the investment committee. But maybe you love that stuff, and contributing in that regard, you might be something that you really find enjoyable. That planning the budget for the organization for the next fiscal year may turn out to be a very pleasant thing. I remember when I ran for vice speaker, I told the council, because I had enough experience in my hospital, that I really love bylaws. And one of the jobs of the vice speaker is to review the digest of council actions and to have the opportunity to opine on bylaws questions and issues. And I love that stuff. The English language is wonderful, and to see how make sure that the words say what you want them to say and achieve the goal you want them to do, I like that. But a lot of people say, bylaws, Albert, how the heck can you do that? It's so boring. Well, you know, you find out what you like and you find out what you don't like.
Yep.
Could I want to make a plug for the practice parameters, because if you love wordsmithing, that's a great committee. You don't have to,
Absolutely.
you're just on conference calls. So I have a young family, and you can really connect with people across the country, and it's a meaningful job. And also working with the ACR, I just want to also say I never knew that I would enjoy the political access that it provides. You know, you get to meet your congressman. I'm working with the CMA, California Medical Association. It's really an enjoyable organization once you start. So I encourage you to join.
Well, thanks so much to our panelists. We have about 5 minutes left, so I just wanted to be respectful of everyone's time. So I'm not sure if we have enough time for just a very quick, like 1 minute sort of closing statement, so to speak, of just, general advice for people on leadership, ACR, just any final thoughts. So maybe starting with Dr. Williams.
Thing I go by is that first, yourself, be true. Be honest with yourself, the things that you're interested in, and try to follow your path. Seek mentorship. That's the best way to grow, and it will save you a lot of painful experiences, if you will. So mentorship is also very, very important. Volunteer. I encourage you to consider the ACR. Look at the different commission and committees that we have available. Plug for Women in Diversity. You can consider being a surveyor. I thoroughly enjoy doing that as well. And definitely for radiation oncology. But again, it's okay to say no. Say yes to what's important to you and find good mentorship to help you in your growth.
Great, thank you so much. Dr. Chang, sort of your closing words?
I mean, I of course echo what everyone says. I don't want to necessarily repeat or anything like that. I'll try to think of something new. But I think ultimately there are multiple ways to get to leadership, multiple ways to skin a cat or whatever the expression is. I would say that the two things that are helpful to me is don't be opinionated. I think it's always important to come in and leave your own opinions outside. And when you talk to people, take on an issue, or you strip yourself of your own biases and and listening is really the most important thing. I think I forgot who said that earlier, but really just kind of understanding listening before you interject your own opinions or your own thoughts, because we really want to let people be able to feel it. I mean, I think those are ways that I've been learn how to take, meetings and interactions with people that can really help bolster that relationship. And hopefully, you're standing as a leader.
Thank you so much, Dr. Chang. Dr. Schechter, your final thoughts?
Well, I just come from a place of respect for the people who have come before us and the experts around the country. I think having an open mind when you're on these committees to hear from others and learn what they're thinking, I think is really a great attitude to have on these conference calls.
Excellent. Thank you so much. Dr. Blumberg, your final thoughts?
I think that there's lots of opportunities, whether it be in organized radiation oncology, radiology, or some other at your hospital, in your state medical society. As Dr. Schechter mentioned, I was very active in my state medical society as well. And I think that was very important for radiation oncology to be seen as an equal partner to the orthopedist, the cardiologist, the general surgeons. And the water's warm, jump in. You may find you like swimming.
Great, especially if the swimming is bylaws, right? But yeah, thank you so much to our wonderful panel. I just want to be respectful of everyone's time. As we've talked about, time was a limited resource. But just thanks to all of our participants as well. This has been really exciting for us. And as you can see on the slide here, our next webinar will be on May 6th. We'll be taking into account the feedback that people leave on the questions, so please make sure to fill those out. And then Just wanted to give a big thanks to Dr. Saeed and Ms. Teresa Powell for their wonderful leadership on this as well. And just wanted to thank everyone so much for joining. So thanks to everyone.
Thank you.
Thank you.
Thank
Good
you.
night.
Bye, everyone.
Bye.
Bye.
Thanks, Teresa.